My name is Dr. Troy Schumann. I'm the director of the Medical Bariatric Service associated with St. Elizabeth Physicians.
My name is Ryan Moon. I am the director of the surgical side of the St. Elizabeth Weight Management Center. I think it's really important for patients to understand that it's truly a collaborative effort. We see patients that may be surgical candidates. If they're not surgical candidates, instead of them going elsewhere, we have a very strong medical program with bariatric experts that we can send patients to, so patients really don't have to look anywhere else.
The goal for the medical weight loss patient is actually to see improvement in health, improvement in life quality, and to see them getting their life back. I chose this especially because I suffer for the same problem. I have a history of being morbidly obese and fought through this problem as well. So I walk the walk, talk the talk, and I feel that carries a lot because I understand what a lot of these patients are going through.
I think the mission of the surgical side is very simple. I don't necessarily want us to be known as the busiest practice or our factory, as you will. But what's really important to all of us here is to be known as the safest place.
And this goes along with that multidisciplinary approach that we have, so that if I have patients that come in that do well but still need more or have more metabolic problems that may benefit from the surgical intervention, I can refer them over to Dr. Moon and he can help from that standpoint as well. And that's what makes us unique in this area.
People may not realize that we have what's called a Center of Excellence designation. It's a really important thing. Basically, it boils down to one thing, and that is quality of care. It's not easy to get this status. It's accomplished by an outside source where they look at all factors. They look at volume of cases that we do. They interview our staff. They go through a hospital, and it's a really extensive process. And it really means at the bottom line, end of the story, that it's quality of care that we deliver.
The good part about the medical program, we take care of people that are 2 pounds overweight to 200 pounds overweight. We can work from beginning to end. This is set up so that they could be in this program for the rest of their life in our maintenance program in order to help sustain it and prevent regain.
I think it's important to understand the metabolic changes that the sleeve gastrectomy offers. It literally changes your metabolism or your biochemistry within your body, number one. And number two, it actually lowers your set point, which is very different than other medical therapies for surgery. And that's an important point to emphasize with patients, because if your set point's lower, your body is naturally going to try and go down to that weight. And that's one thing I think that's often overlooked with surgery for weight loss.
Just the other day, I had a young lady that was in, and she just kept looking at me. I was like, okay, I'm missing something here. And then I looked, and it's like, she's crossing her legs. And those are the kind of little things that you get. It could be as simple as tying your shoes, being able to see your shoes. I mean, these are the things that these people, haven't done it forever. And it's just like, you can see them glowing when they come into the room because they're able to do something they couldn't do that you and I take for granted every day.